Hello everyone. Today we will learn about the femur, the thigh bone, right? This is the femur. First of all, we have to hold it in an anatomical position, right? So, this is a femur. Femur in Latin it is called as thigh. Okay, it is a type of a long bone. It is a strong bone and it is a bone, upper bone of thigh or a leg or a lower limb. It is as analogous with humerus of upper limb, right? It is a top type of a long bone. It is a vertical long bone. It has three ends. It has two ends, upper end and lower end, and a shaft that every long bone has, right? Now let us see its side determination. So if you want to know whether it is upper part or lower part, so upper part contains the head and it is a rounded part, so we can easily understand the upper end. Now downwards, the lower end is bicondylar, so you can easily identify this end too, right? Now let us see the each end in detail. Now when we look for the upper end, we can see there is a presence of a head, right? So this head, it covers the more than one half of a circle. It resembles to that. Upper end also contains greater trochanter, lesser trochanter, trochanteric fossa, intertrochanteric line, intertrochanteric crest, intertrochanteric line and intertrochanteric case, a crest. So now when we see the upper end, there is a head, and below the center of the head towards the medial side there is a presence of a pit, the presence of a hole called as fovea. Now when we see the fovea here, and when we come towards the neck is very important when you learn about the any anatomy, when you learn about the anatomy of a femur. Okay, now the neck contains two borders, upper horizontal border and lower concave border, two surfaces, anterior surfaces and posterior surfaces. Okay, anterior surfaces start from the head and end towards the intertrochanteric line. Posterior surfaces start from the head and end towards the intertrochanteric crest. This anterior surface is flat and this posterior surface is concave upward and downward, and it's convex upward and downward and concave side to side, convex from up and down. Okay, now when you see the neck is very important from clinical perspective. There are important two angles we take with the help of neck from the upper end of the femur. The upper end consists of an angle with the head and the shaft, neck and the shaft. That angle is the angle between the neck and shaft is approximately 127 degree in adults. It can be vary or it can be less in female due to their wider pelvis. Okay, now the second angle very important with the upper end is trochanter and shaft angle. Okay, now when you see about the trochanter and shaft, approximately angle between them is 8 degree. Angle between them is 8 degree. Third one more important angle of the femur bone is it is related to the upper end and lower end. When you take the upper end, when you cut the upper end and you take it here along the transverse axis of the both the ends, the angle between them is called as femoral torsion angle or anteversion angle. It is very important from the clinical perspective. Now, the blood supply of neck. Now let us see how the blood supply is given to the neck of the femur. The intracapsular part means the part which comes under the capsule anterior surface. Most of the part means all part is coming under the capsule, but the posterior part more than medial part is only coming under the capsule. So the intracapsular part is supplied by retinacular arteries, okay, and the posterior part which is extracapsular, which is not coming under the capsule, is supplied by femoral circumflex medial artery. Okay, now when you look about the shaft is concave backwards and convex forwards. Okay, now when you see about the shaft, their borders and all are very tricky. Now very easy to understand is this shaft. When you talk about the middle 1/3 of the shaft, it contains 3 borders and 3 surfaces. Okay, the borders are, I will tell you, this is medial border, this is lateral border, and this is posterior border. This posterior border is more prominent in the middle 1/3. So it gives appearance to 3 surfaces, is anterior surface, medial surface and lateral surface. Now when we go to up 1/3, this middle line this posterior border diverges into 2 parts. One, there is a lateral part of the femoral tuberosity. Here is the presence of femoral tuberosity, and the next it diverges to the spiral line, which now gives 4 borders to the upper part and 4 surfaces to the upper part. Right, anterior surface, this is the lateral lip of a femoral tuberosity. This is spiral line, and here it contains posterior surface, here it contains anterior surface, here it contains medial surface, and here it contains lateral surface. Now as you come downwards, again this posterior border diverges into 2 supracondylar lines, which also gives the birth to the 4 borders and 4 surfaces. These 4 borders are lateral epicondylar line, medial epicondylar line, lateral border and medial border, and gives 4 surfaces, which is anterior surface, this is lateral surface, this is medial surface, and this is presence of popliteal surface. This is all about the shaft. This shaft is convex forwards. Now when you come towards the lower end of the femur, it contains 2 condyles. This is lateral condyle and this is medial condyle. Now when you see about the condyles, or when you see about the lower part from forwards, this notch which is present on the anterior part, it is related with a patellar surface, and here it is related posteriorly, it is related with tibial surface. Now when you talk about the lateral epicondyle, when you talk about the lateral epicondyle, this epicondyle is more similar, or it is very continuous. It is very continuous with a lateral line or lateral border of the shaft. So it can bear the more weight, or it can bear a stouter weight or more weight very efficiently. Though the medial epicondyle is more prominent, but the lateral epicondyle is stouter and stronger to hold or to gain the weight. Here there is a towards little anterior side or towards the lateral surface there is a presence of a tuberance called as lateral epicondyle. Same it is presence over the medial part. Now when you talk about the medial epicondyle, this medial epicondyle is literally far away from the shaft, medial border of the shaft. Okay, now upward to the this condyle there is a presence of a tuberance which is very prominent, like that of the medial epicondyle of humerus. Here also medial epicondyle of the femur is also very prominent, and above that there is a presence of abductor tuberance which is also a very important from clinical perspective, because from here it passes a epiphyseal line for the development of femur. This line this line is present, or this abductor tubercle is present on the crest which is just above the tuberance present on the medial epicondylar tuberance. Okay, this was all about the external features or the anatomical structure of femur. Now let us talk about its attachments. Very few attachments we will take of the femur, right? So there are insertions and there are origins of some muscles on femur. Okay, now let us talk about the insertion. Now towards the upper part of the graded trochanter there is a presence of piriformis. There is a insertion of piriformis at a muscle. Now when you come towards the shaft, on the shaft there is a origin of lateral vastus, medial vastus and intermediate vastus muscles. And towards the upper end there is a presence of ligaments. Okay, these ligaments are forming the hip joint, and lower there is also a capsular ligament forming a knee joint, here with the help of patella and here with the help of tibia. Right, now there are two more crucial ligaments present in the lower part. They are called as anterior cruciate ligament and posterior cruciate ligament. They are very important from the clinical, very important from the clinical perspective here, because there are many cases for the tear of this ligament. This ligament, now anterior cruciate ligament, is present on the posterior part of the lateral epicondyle, and same the posterior cruciate ligament is present on the anterior surface of the medial epicondyle. When we talk about the ossification of this bone ossifies with a 1 primary center and 4 secondary centers. Now when we talk about the clinical anatomy of this bone is very strong bone, but the fracture can occur in this bone. The fractures are of many cases, and it is divided to year wise fractures. This 16 year there is a fracture is different, for 25 years there is a fracture is different. One more fracture comes under this is Pott's fracture. Okay, now when we talk about that ACL and PCL, that is posterior cruciate ligament and anterior cruciate ligament, they are very important from the perspective of TKR, total knee replacement, etc. This was all about the humerus. Thank you.